Last week, I met a dog owner who was more afraid of the medication than the disease itself. Her dog had just started taking steroids. Within a few days, he was drinking much more water, asking to go outside constantly and acting hungry all the time. She looked at me and asked, "Doctor, are these medications hurting my dog?" If your dog is taking steroids right now, you've probably asked yourself the same question. Here's what might surprise you. For many immune diseases, the disease itself is often far more dangerous than the steroids used to treat it. Today, I'll explain why veterinarians prescribe steroids, how we minimize their side effects, and why stopping them too early can sometimes be a very serious mistake. Before we begin, a quick note. This video focuses on steroid treatment for immune-mediated diseases in dogs. Steroids are used for many different medical conditions, and treatment plans can vary depending on the disease. Always follow your own veterinarian's recommendations for your dog's specific condition. Hello, I'm Hello Pet Care Vet. Thank you for joining me today. One of the biggest misconceptions I hear is that steroids are simply bad medications. The truth is much more complicated. Like any powerful medicine, steroids have risks, but they also save lives every single day. The key isn't avoiding steroids. The key is knowing when they're necessary, how they're monitored, and how veterinarians safely reduce them over time. Let's begin by understanding why dogs with immune diseases need steroids in the first place. Think of your dog's immune system as a security team. Its job is to find dangerous invaders like bacteria and viruses, then destroy them before they can cause harm. But sometimes the immune system makes a mistake. Instead of attacking germs, it starts attacking the dog's own body. Sometimes it attacks the brain. Sometimes it destroys red blood cells. Sometimes it attacks platelets, making it difficult for blood to clot. And sometimes it causes ongoing inflammation inside the intestines. These are called immune-mediated diseases. Without treatment, they can cause permanent damage. Some can even become life-threatening. This is exactly why steroids are so important. Steroids don't simply make dogs feel better. They calm the overactive immune system before it causes irreversible damage. For many dogs, steroids are not just helpful, they are life-saving. Most owners notice changes within the first few days after starting steroids. Their dog suddenly empties the water bowl. They ask to go outside every hour. They're constantly looking for food. Some dogs even start panting while resting. If this is happening to your dog, you're not alone. These are some of the most common steroid side effects, and surprisingly, in many cases, they don't mean the medication is harming your dog. These changes happen because steroids affect the body's normal hormone balance. Most of them improve as the dosage is gradually reduced. Of course, your veterinarian will continue monitoring your dog closely to make sure everything stays on track. Now, let's answer the biggest question. Are steroids dangerous? The honest answer is yes. They can cause significant side effects. But here's the part many people don't think about. Imagine your house is on fire. The firefighters arrive and spray thousands of gallons of water. Will the water damage your furniture? Probably. But would anyone tell the firefighters to stop? Of course not. Saving the house comes first. That's exactly how veterinarians think about steroids. Our first priority is stopping the immune system from destroying the body. Only after the disease is under control do we begin reducing the medication. The goal has never been to keep dogs on high-dose steroids forever. The goal is to control the disease while using the lowest effective dose possible. And that's where the next part of the treatment becomes so important. This is probably the question I hear most often. Will my dog have to stay on steroids for the rest of their life? The answer is not necessarily. Every dog is different. Some dogs are eventually able to stop steroids completely. Others may need a very small maintenance dose for a longer period. It all depends on one thing: how well the immune disease stays under control. Our goal is never to keep dogs on high-dose steroids forever. In fact, veterinarians begin planning steroid reduction as soon as the disease becomes stable. We slowly decrease the dose over weeks or months while carefully watching for any signs that the disease is returning. If everything remains stable, we continue reducing. If symptoms begin to return, we may slow down the taper or temporarily increase the dose again. Treatment is never based on a fixed calendar. It's based on how each individual patient responds. Many owners become even more worried when they hear that we're adding another medication. They often ask, "Doctor, if steroids are already strong, why does my dog need another immune suppressant?" It's a great question. The answer may surprise you. We're often adding another medication, so we can use less steroid, not more. Drugs such as mycophenolate mofetil, cyclosporin, or leflunomide help control the abnormal immune response. As these medications begin to work, they often allow us to reduce the steroid dose more safely. Veterinarians call this a steroid-sparing effect. In other words, the second medication isn't usually added because treatment has failed. It's often added because we're planning for safer long-term management. Here's some good news. Many owners think steroids are something their dog will need forever, but that's not always true. Some dogs respond extremely well to treatment. As their disease remains stable, veterinarians may gradually reduce the steroid dose until it's completely discontinued. The dog then continues taking only the immunosuppressive medication. This is something we often hope to achieve. However, it's important to understand that this isn't possible for every patient. Some immune diseases are more aggressive. Some dogs simply don't respond well enough to immunosuppressive medications alone. For those patients, stopping steroids too soon can cause the disease to return. That's why we never decide based on hope alone. We decide based on your dog's response, physical examinations, blood tests, imaging studies when needed, and long-term stability. Every treatment plan should be individualized. Now let's talk about one of the most dangerous mistakes owners can make: stopping steroids without veterinary guidance. Many owners think, "My dog looks normal now, so maybe the medication isn't needed anymore." But remember, your dog often looks better because the medication is working, not because the disease has disappeared. There's another reason sudden withdrawal can be dangerous. When dogs receive steroids for an extended period, their bodies reduce their own natural cortisol production. If steroids are stopped abruptly, the body may not be ready to replace that hormone immediately. Dogs can become weak, lose their appetite, vomit, develop diarrhea, or become seriously ill. That's why steroids should always be tapered slowly under veterinary supervision. Although some side effects are unavoidable, there are several things you can do to help your dog stay healthier during treatment. First, give every medication exactly as prescribed. Second, always provide unlimited access to fresh water. Never try to reduce drinking by limiting water. Third, watch your dog's weight carefully. Steroids increase appetite, and obesity creates additional health problems. Fourth, keep every scheduled recheck appointment. Blood tests and urine tests help us detect problems before they become serious. And finally, call your veterinarian if you notice vomiting, diarrhea, blood in the urine, severe lethargy, difficulty breathing, or any sudden change in your dog's condition. Early intervention is always better than waiting. So, are steroids dangerous? Yes, they can cause important side effects. But for many immune-mediated diseases, the disease itself is often far more dangerous than the medication. The goal isn't to avoid steroids. The goal is to use them wisely, control the disease, reduce the dose whenever it's safe, and if your dog responds well, possibly transition to long-term treatment with little or even no steroid at all. Every dog is different. That's why the safest treatment plan is always the one designed specifically for your dog. If this video helped you better understand steroid treatment, please give it a thumbs up and subscribe for more evidence-based pet health information. Thanks for watching, and I'll see you in the next video.